If you're active and you're having pain on the inside of your shin, this is one of two conditions it's often referred to as shin splints, and it also can be a medial compartment syndrome, and it can also be medial tibial stress syndrome. We want to assess you. Most of the time this is from people that are training hard and usually that roll in, so they're on improper footwear, they're training on uneven surfaces. There can be bone density and hormonal issues that are a part of this as well. But what happens is if the foot, every time it steps down, it rolls in like that under load, it's bowing this tibia that way. It starts to stress the bone out. Now, so we assess you for that first and make sure that that's not the case. So we might start with an x-ray to rule out a stress fracture, stress reaction. Just to be on the safe side, we might have to do an MRI too. But if those come back negative, sometimes it's just the muscles of the deep posterior compartment that would be supporting your arch. And those would be the big toe flexor called the flexor hallucis longus and the flexor digitorum muscles, and another one called tibialis posterior. If they're not strong enough, they'll let the foot roll down. And they often are not strong enough because they become fibrotic from overuse. So we'll come in and we'll assess, once we've ruled out the worst things, come in and assess those muscles and then treat them. So for example, the first one that I feel right here off of the tibia is going to be his flexor digitorum, and I can feel that by moving the toes here. Look at this one, there we go. Okay, so then I'm going to treat that, and I'm going to make sure it's not too, make sure it's not too tender, right? And then I'm going to dorsiflex his ankle, extend his toes, start to release the adhesions that have developed posterior to his tibia, right where I am. And I may have to also come a little further around and get the tibialis posterior. I don't have to worry about the toes when I do that. By releasing the adhesions, some of the strength will start to come back to the toes, and I'll have to follow that up with some exercises to stabilize for foot and ankle stability so that this doesn't happen. So usually it will involve a little bit of time off, not too much, all right, and then some rehab exercises to stabilize the ankle after we've done the active release technique treatments. I hope that's helpful. If you're having any kind of pain in the medial side of your ankle and you're athletic, come in and see us at